This year for World Physiotherapy Day, we had the privilege of interviewing notable members of our physio community on the theme of low back pain. We hope this video helps foster a sense of professional identity within our student community and helps advocate for the increased support of physiotherapy services. Could you share a little bit about your career or your work and how and if you're involved with the low back pain population?
Yes. So I graduated in 2015, my Bachelor of Physiotherapy at University of Queensland. Been working in musculoskeletal private practice ever since.
An emerging NHMRC emerging leadership fellow at UQ. I take great pride in trying to understand what's happening at the very minuscule level and how everyday factors can influence those things that ultimately influence someone's back pain.
Yeah, so I'm a final year student in the undergrad program.
I work full time as a senior lecturer at the University of Queensland, so I get to teach into a number of courses and coordinate a number of courses that include where we look at low back pain and pelvic pain, and also I lead the musculoskeletal stream of our simulation program, which students get to undertake in their final year before they go out on placement.
So then that brings us to why should people care about low back pain, right? Apart from that, what should the general public know when it comes to low back pain?
Yeah, so I mean, yes, we should care about it because it's so prevalent. It's one of the most common musculoskeletal disorders in the community. It affects people no matter how old you are. It's not like the older you get, the worse or the more likelihood of it. It's quite prevalent across all age groups. And it's not necessarily just a sedentary issue. A lot of athletes can have issues with lower back pain as well. So really, it affects everyone. It can affect anyone, I should say.
It's not only hugely prevalent, but for those people who do have disabling and ongoing low back pain, it's a massive driver of disability, things like time off work. And it's one of the highest reasons that people are forced to retire early or leave the workforce and not re-enter it.
But I think really a message should be that there are ways to help with it. And so seeing various health professionals is something that you shouldn't shy away from.
I think too, what we're seeing more of now, especially in social media, are people oversimplifying persistent low back pain into things that there can be a quick fix for. And I think this is really unhelpful. So I would want people to know that they should be really careful and a bit dubious about what they see online. So one of our roles that we often don't think about is how can we help the public navigate this information they're accessing online in really helpful and accurate ways.
So shall we talk a little bit about the role that physios possibly play in the management of low back pain?
Our job as researchers and clinicians is to identify the things that contribute the most. Firstly, and secondly, we have to identify the things that contribute the most, but are also very modifiable. And that does limit the list.
And two really simple examples are the role of physiotherapists in the emergency department, like recognizing that physiotherapists are the experts on triaging and managing the vast majority of musculoskeletal conditions, including acute low back pain, that arrive in the emergency department, of which low back pain is a huge presentation in emergency. So I think that's really exciting that we're recognizing physiotherapists can be leading in the space. And the other is the many screening roles that physiotherapists have, particularly with orthopedic conditions and things like that in the public healthcare system.
Our role, with assessment and working out what's actually going on and treatment, as I said, we can treat it so effectively and relatively simply. It doesn't need any fancy gadgets or gizmos or, any complexity to it. It can be relatively straightforward, and often I find the simplest things are actually the things that are most effective.
It's about providing entry-level physiotherapy care as a student while you're still learning and on placement. And even once you graduate as well, it's as a new graduate, it's looking at entry-level management. And so it's really for non-complex cases of low back pain. So we can listen to people and we can hear their stories, and then we can, knowing what the evidence base out there says about low back pain management,
What has changed though, which I think is really important and really exciting, is that the role of the physiotherapist has evolved, and it's evolved hugely in the last 10 to 20 years. So now we're not only recognizing that psychosocial factors are critical in someone developing persistent low back pain, but we're able to take a more active role in screening for these things, exploring these impacts with patients, and recognizing where they're relevant and what to do.
What I would say that's changed over the last 5 or 10 years since I've been involved in research is that we've done a better job of identifying the things that we think are more important, but we also consider these things together and how their relationships affect outcome. And I'll give you an example. We've known for some time that sleep is associated with back pain, pain in general. We used to think that it was pain that was causing problems with sleep, but what we know now is that it's more likely that sleep is driving changes in pain.
A lot of the management back in those days was retraining transversus abdominis activation and multifidus, which we still did exercises. You know, that's always been prevalent as well, but I think now it's sort of more, it's highlighted even more the role that exercises can play in the management of lower back pain. Patients who come in who've had imaging, say from their GP or something like that. So, you know, we know that a lot of things that we see on a scan may not be clinically relevant or may not be directly related, I should say, to the patient's symptoms. So there'll often be the misconceptions, you know, patient's got a disc bulge or loss of intervertebral height. Or it is a challenge to discuss that with patients, but it is something I find that most people, as long as you're not dismissive of their concerns, I think as long as you're sort of saying, I hear your concerns, and you sort of bring up with them, you say, oh, well, actually, you might be surprised to learn that, such and such.
Talking about shared decision making just then, it's like you've mentioned, you brought it up, is really important because it can be as simple as someone just not liking an exercise for whatever reason. They just don't like it. They won't do it, and they're not going to get better. Whereas you could find an exercise that targets the same thing or whatever it is, and then they might do it, and then that makes such a big difference, rather than just giving them an exercise that you think, oh yeah, I know this one, I know it will work.
We can teach the patients to manage their pain adequately. We can get that pain down. But what was the most important for us was to work with our patients collaboratively. We need to look at all these other contextual factors when it came to the social factors, their psychological factors, if they're able to get back to work, if they have to support their family, and really work with them to find ways that they could increase their participation. Once they were able to get back to what they can adequately participate in, we found that, at least for the case studies, that was when the low back pain wasn't really a priority anymore. It was because they were getting anxious that this low back pain could be affecting all these other factors of their life. That was when it was a main problem.
How I like to phrase it to patients is, we've got the things that the low-hanging fruit, the things that we know should work, most of the time, like the exercises and the advice and education. But if we need to then look at other things, manual therapy, I've even some patients, it's not how I would treat them, but some patients will come in and say they've had ultrasound for their lower back pain, and that's been really effective. And so as long as it's not harmful for them, as long as there's no contraindications or anything like that, I'd be silly not to consider those things, because if that's what's going to help them, well, then that's obviously a good thing.
See people that in front of you, they're not just the health condition that you've learned about, I think is one of the big ones. And that just be able to talk to people, just sit down and have a chat with them, take an extra few minutes, if someone's upset or if they want to talk about something, because that could really make such a difference.
Well, but I think particularly as a student and a new grad, when you don't have that experience, I think the best thing you can do is just observe, shadow, ask questions, and that's how you build your confidence. When I first graduated, this wasn't as prevalent. Social media actually can be a good thing for clinicians. There's various resources, such as the APA Musculoskeletal Facebook page, which more often than not has some pretty good guidelines there.
educate the patient such that they buy into what you're telling them is really potentially really having an influence on their pain. And if you can do that by understanding how that works, do some reading in sleep, pain, immune system type things, get an understanding of how diet influences the immune system and the nervous system and pain. If you can gauge that, get an understanding of that knowledge and translate that to the patient, they'll buy into the treatments that you might give in that area. That would be my tip.
Is students often come in with an expectation that if they find a diagnosis or an injury, then they'll know what to do in the patient's management. And if they don't find a clear diagnosis, they can't follow a clear approach as to what to do. Now, this kind of approach is really helpful in sports medicine and when we've got injuries, or particularly sporting injuries. Having a diagnosis is critical, and we can use that to guide management. The reality is, though, that in musculoskeletal practice and in low back pain, most patients we see in the community have insidious onset musculoskeletal pain or low back pain. So it might come on really gradually over a few days or even weeks or even months without any trauma. So getting a really clear diagnosis at a tissue level is just not realistic, and it's not possible. And as a researcher and a teacher, we often refer to this as diagnostic uncertainty. And my research has looked at how students and new grads navigate what to say to a patient and what to do if they can't find a diagnosis. So that to me is where students, not just in physiotherapy, but across health professions, struggle with the most. What do I do if I can't find a diagnosis? So I really believe that we need to focus on this more in teaching, so that when students and new grads get out into practice, we're a bit more comfortable with going, okay, I don't have a really clear diagnosis. That's okay. I can navigate it and I can still help the patient in front of me. And one of the most important things we need to think about when we're going out onto clinical placement, but more so when we're going out into the workforce as a health professional, is to just move away and steer away from anything that implies our job is to fix people. So moving away from the fixing mentality and towards the supporting mentality is better for you. There's going to be much less burnout, and it's way better for the patient.
Thank you to our speakers for sharing their expertise. Physios play a pivotal role in managing musculoskeletal conditions like low back pain, whether through research, education, or clinical practice. As a student society, we are proud to advocate for the profession, and we remain hopeful for government financial support of allied health students on placements. Investing in students will not only benefit the future of the respective professions, but is essential for improving the health and well-being of our communities. Thank you.